Imagine a world where your medication admits when you have actually taken it, and where missed pills no longer silently push patients toward organ rejection, AIDS, or deadly tuberculosis. MIT's Safari system turns that world into real science, a standard capsule that stays completely invisible to your body's chemistry until you swallow it, then whispers a wireless signal proving ingestion happened. The genius? The entire device dissolves within days, leaving zero toxic waste, zero retrieval surgeries, zero electronic garbage in the GI tract. This is the smart pill that makes medication adherence visible, trackable, and finally life-saving. Nearly 50% of patients abandon their medications entirely, a silent crisis that bleeds nearly 125,000 preventable deaths every single year across the United States, while draining over $100 billion in avoidable healthcare costs. The burden crashes hardest on the most vulnerable, organ transplant recipients, where one missed immunosuppressant dose triggers irreversible organ death, HIV patients whose non-compliance accelerates collapse into full-blown AIDS, tuberculosis sufferers where poor adherence breeds drug-resistant superstrains, cardiovascular patients facing sudden stent thrombosis, and those battling neuropsychiatric conditions that make consistent dosing feel impossible. One missed pill compounds into catastrophe, yet nobody knows it happened. Meet Safari, smart adherence via Faraday cage and resorbable ingestible. Inside a standard gelatin capsule hides a tiny radio antenna wrapped in a plant-based film and sheathed in a thin protective metal layer, creating an electromagnetic shield that blocks all wireless signal. You swallow the pill, it feels like any other tablet. Your stomach acid hits the coating, dissolves it in minutes, and suddenly the antenna wakes up. It broadcasts at 915 megahertz to an external reader positioned up to 2 feet away, confirming ingestion has occurred. That signal travels to your care team through a wearable relay device. The beautiful part? Within days, every component except one tiny biocompatible chip breaks down completely, leaving nothing behind. Silent, certain, invisible medicine that actually speaks. Here's the engineering breakthrough nobody's talking about. MIT scientists unlocked 3 game-changing innovations buried inside this capsule. First, they miniaturized the brains of the device, an Impinj M700 chip barely 400 micrometers across, small enough that X-rays can barely see it, yet powerful enough to broadcast across rooms. Second, the signal radiator itself is a precision-bonded metallic trace on a degradable polymer backbone, a structure that breaks down predictably, safely, and completely within 7 days. Third, the electromagnetic shielding uses a blend of transition metal particles suspended in a gel-like matrix, creating a Faraday cage so effective it blocks RF signals until stomach juices dissolve the coating. Only then does the hardware wake up and confirm ingestion within 10 minutes. This is bioresorbable engineering that rewrites what ingestible electronics can do.
We just explored how Safari works. Now let's talk about what it changes for real patients. Consider an organ transplant recipient. One missed immunosuppressant dose can trigger irreversible rejection and organ failure within days. With Safari, doctors know instantly whether that dose reached the patient's stomach. No missed calls, no guesswork, no tragedy that could have been prevented. The system is non-invasive, no needle sticks, no blood draws, no hospital visits. Just a quiet digital checkmark that helps clinicians keep life-saving therapies on track. And it eliminates the shame. Patients struggling with adherence no longer hide missed doses. Clinicians see the truth in real time, enabling them to intervene with support, not judgment. This transforms medication adherence from a secret battle into a visible partnership. As we wrap up this Safari story, every patient and doctor asks the same first question: how safe is this smart pill? The answer starts with its building blocks: tiny doses of zinc, about 20 milligrams, and molybdenum, around 20 to 30 milligrams, both essential trace elements your body already knows how to handle. In swine studies that closely mirror human digestion, the capsule material was shown to break down fully, reliably flag each swallowed dose, and leave zero device buildup in the gut. Blood serum tests told the same reassuring story. Zinc and molybdenum levels after the pill were virtually identical to baseline, and extra exposure was minimal compared to what you get from daily food intake. That safety profile is exactly why Safari is now advancing into Phase 1 human clinical trials, backed by Novo Nordisk, MIT, Harvard, and ARPAH, moving from lab bench directly into real-world patient care.
To finish our Safari journey, let's zoom into the clean exit strategy engineered right into this smart pill. The moment the capsule hits your stomach's acidic environment, the electromagnetic shielding dissolves within about 10 to 20 minutes, instantly flipping the RFID signal from silent to active. Over the next 24 hours, the internal conductive elements and their metallic coating break apart into progressively smaller pieces that continue to resorb safely. Then the slower phase begins. Across several weeks, roughly 21 days, the underlying support film gently degrades through hydrolysis, softening along the way for smooth passage through your entire GI tract. Only one piece is engineered to stay intact, the tiny 400 by 400 micrometer RFID chip, a biocompatible square that simply rides through your digestive system and exits naturally in your stool, causing no damage. It's a timed, stepwise biodegradation masterpiece. Standing at the end of this series, one thing is clear. Safari is really a preview of invisible, intelligent medicine. But the real revolution begins when we stop thinking about this pill as just an adherence monitor. The same ingestible platform opens doors to device localization, pinpointing exactly where a medication reaches in the GI tract. It enables RFID-guided drug delivery, where targeted payloads release at precise anatomical sites. It powers advanced bioresorbable communication networks, running silently through the digestive system, transmitting data about gut health, inflammation markers, and disease progression in real time. Imagine capsules that don't just confirm you took your medicine. Imagine capsules that monitor your healing, that catch disease years before symptoms appear. That's the future Safari is building. That's where ingestible electronics are headed. And it starts with trust, a smart pill that proves you took your dose.
Subscribe to BioTuber online and unlock unlimited potential to improve every aspect of your health. Find real solutions for weight loss, blood sugar management, heart health, and mental resilience. Plus, science-driven answers for balancing hormones, boosting immunity, supporting healthy aging, optimizing digestion, managing pain, and preventing chronic disease. Learn to recharge your energy, enhance sleep, sharpen memory, and build strength through trusted fitness routines and nutrition plans grounded in the latest medical research. Explore topics like gut health, stress reduction, inflammation control, women's wellness, men's health, skincare, mindful living, reproductive health, bone and joint care, and integrative therapies. No matter your age or goal, this channel simplifies cutting-edge studies and expert insights, offering practical tips for total wellness, physical, emotional, and social. Join the BioTuber online community for step-by-step guidance, actionable strategies, and daily motivation you can rely on. Subscribe now for evidence-based content and never miss an opportunity to thrive in every area of your life.